In this video, we're going to be talking about spinal injury, and we're going to cover some common spinal injuries that you might come about at work or in your home environment. Spinal injury can occur in any high impact accident, such as a car crash, a sporting event such as rugby or football, riding a bike or a motorbike, even horse riding. But for the purpose of this video, we're going to be doing a fall from height. So our casualty has been working up high, he's falling off the ladder, and he is conscious and breathing on the floor. It's very, very simple what we do, and I'm going to explain it to you. There's a fundamental thing we have to understand when dealing with spinal injury. We're not going to move them until a professional, a paramedic, a doctor, or any other emergency personnel can say otherwise. But we can do some simple first aid. So we're going to check the scene, make sure that it's safe to enter. Once it is safe to enter, we're going to look at the patient, okay? We're going to look for any bleeding. Is there any hemorrhaging? We're going to look at the head. We're going to start a top to toe search. Make sure there's not any bleeding. What do I mean by that, guys? Very simply, we're just going to put our hands by the head. We're going to be very careful not to move the patient. If the patient's conscious, we'll say to the patient to keep still and do not move any limb, okay? We're just going to check for any bleeding by just touching our hands on the patient and going down the body. If you have personal protective equipment such as gloves and eyeglasses, please use it. If you haven't, it's your judgment whether you want to continue, but this is a very fundamental thing to do. We're going to check head to toe, making sure that there's no bleeding. If there is bleeding, guys, we're going to treat the bleeding, okay? We're going to stop any bleeding. If it's serious bleeding, we can use tourniquets, we can use dressings. We'll cover that in further videos. But for the purpose of this video, we're just going to check that there's no blood pouring from the body of the patient. If you've got a mobile phone, guys, at this particular point, please call for an ambulance. If there's a bystander or a workmate, we're going to ask them to call the ambulance for us. So once we've checked for any bleeding and we've addressed any basic concerns with regards to first aid, it's about stabilising the patient until help arrives. There's one fundamental thing that you can do to help the patient. If the patient's alert and responsive, you can tell the patient to keep still. If the patient is unresponsive, then you can use the technique I'm about to show you, but obviously be prepared to start CPR if needed. To keep the patient still, hold the patient's head and neck still by holding them in place with both hands. Then wait for an ambulance to arrive. The goal of spinal immobilization is to prevent further injury to the patient and their spine. If needed, provide basic first aid such as stopping any bleeding and make the patient as comfortable as possible until help arrives. If the patient's outside and there's cold temperatures, try and cover the patient with a blanket or a coat or clothing or any type of clothing you can. This is to simply stop hypothermia.